So, Dorothy, you're here today. How many weeks after your surgery?
5.
5 weeks.
5 weeks.
Well, since obviously we're the only two who knows what's going on, I'm going to tell a little bit of a story of how we met. So we met back a couple of months ago, right?
Yes.
And you came to me after you had seen several other podiatrists, right?
Yes.
And you've had this problem for a couple of years, from
Yeah,
what I
it's
remember,
quite
right?
a bit, and none of them ever told me what was wrong.
Right, and so when we took an x-ray and then we ordered a bunch of other tests, we found out that you had peroneal tendonitis, and you also had os peroneum that was broken in multiple pieces.
Yes.
And that was causing you pain. And obviously we've tried everything non-surgical.
Yes.
Well, you've tried a lot of non-surgical things before you even met me. So I went in there and I basically took those fractured fragments out.
Yes.
And I also repaired and grafted that tendon. And you're a diabetic, so I was a little bit concerned because obviously we know that in diabetics you guys don't heal very well, but you did remarkably well.
Thank you.
I mean, come on, 5 weeks, and you just told me that you have very minimal pain, right?
Only thing I have is a little bit of tightness in my ankle.
Right. Well, I mean, you have to understand, you're only 5 weeks out,
Yeah.
and you were non-weight bearing for how long?
4 weeks.
4 weeks, right?
So and little by little, I started
right.
after that.
So you just literally started learning how to walk again.
Yes.
Right? And we also know that when somebody had this condition for a couple of years, it takes longer for the tendon to heal up because there's always scar tissue, there's always, a lot of secondary things that are happening when it's not addressed immediately, right?
Yes.
So for people who have the peroneal tendon injury, or for people who suffer and everybody tells them there's nothing wrong with them, would you recommend, coming here?
Yes, definitely.
So are you happy with your surgery?
Absolutely, yes.
And this is just the beginning. This is just the first 5 weeks.
Yes.
So, and I'm happy that you like your orthotics too. But I can tell you is, remember how we used that amniox graft?
Yes.
Right? So I've operated for 19 years. I've been in practice for 19 years. And I can tell you is that amniox grafting of the peroneal tendon is what really revolutionized that procedure. Because before it would take probably about 3 to 4 months before people stop limping.
Oh, really?
Yes, so I can tell you is that in the past couple of years it really was a huge game changer, at least in my practice, because it really makes everything heal faster and it makes the tendon stronger. So, but you are a wonderful patient. You followed my instructions. Yes. And you did very well. So pat yourself on the back.
Oh, thank you.
So.